Pneumococcal pneumonia affects the respiratory system via the lower respiratory tract, where the disease inflames the lungs and disrupts alveoli effectiveness. It is known to affect all age groups with an increased risk for older adults, and causes long-term health conditions which at times can result in hospitalization and death. It is caused by the bacterium known as Streptococcus pneumoniae, which transmits through respiratory droplets in the form of saliva or mucus, through coughing, sneezing, or talking. The symptoms typically associated with pneumococcal pneumonia include, but are not limited to, coughing with green or yellow mucus production, shortness of breath, and a fever.
Pneumococcal vaccines work by stimulating the body's immune system to produce antibodies that fight pneumococcal bacteria. There are two types of pneumococcal vaccines, polysaccharides and conjugates. Pneumococcal polyvalent vaccine is an active immunizing agent used to prevent infection by pneumococcal bacteria. This process triggers a response from B and T cells, which results in mucosal immunity. Immunity develops 2 to 3 weeks after vaccination and can last for up to 5 years. The pneumonia vaccine can help protect society by preventing some forms of pneumonia, which can be serious and sometimes fatal. It helps by reducing the length of hospital stays. Studies have shown that the reduced rate of hospital stays on average went down by 41.7% for patients with chest diseases, and the cost of hospitalizations went down by 27.8%. Studies have also found that pneumonia vaccine can reduce mortality rates for people with pneumonia. In one of these trials, it showed that the vaccine can reduce the risk of pneumonia in people ages 65 and older by almost 64%. The pneumonia vaccine can also indirectly protect unvaccinated people by reducing the risk of transmission of pneumococcal bacteria into the population.
I'm going to stop our normally scheduled show here to make sure you are all still with us during our presentation. Here I have a question with the answer that comes straight from the presentation, and I want you to choose an answer you see as best fit with the information we have provided you so far. You can go ahead and pause me here or after going through the answer options to choose your answer. Alrighty, so how is pneumococcal pneumonia bacteria transmitted? A. Transmission occurs via contact with an infected person who spreads microbes either directly or indirectly. B. It is transmitted via contaminated food and beverages. C. Transmission occurs via respiratory droplets of saliva and mucus from a person carrying the bacteria when they sneeze, cough, or talk. D. There is no transmission involved because we are all infected with pneumococcal pneumonia. The correct answer was C. Transmission occurs via respiratory droplets of saliva and mucus from a person carrying the bacteria when they sneeze, cough, or talk. Because pneumococcal pneumonia affects the respiratory system, resulting in the spread of bacteria being through respiratory droplets such as saliva or mucus. The pneumococcal vaccines are available in two forms, polysaccharide and conjugate vaccines. Both are effective in that they stimulate the production of little personal bodyguards within the body, known as antibodies, that work by removing unwanted pneumococcal bacteria from your body. After vaccination, it takes roughly 2 to 3 weeks for immunity to develop and lasts up to 5 years. And while all age groups benefit from vaccination, the most vulnerable age group is older adults who have decreased immunological responses to vaccines. However, vaccination may also result in population immunity, which may function as an additional defense barrier for older adults. That is why vaccination is important in all age groups, because it reduces infection rates, death rates and hospitalization rates.